I'm Molly Tickner, the President of Clinical Services. I've been with FosterAdopt Connect since December of 2021. We serve the most vulnerable youth that have experienced a high level of trauma, numerous frequent moves, whether they're in foster care, adoptive care, kinship placements, or in their biological families and just need that extra support. We keep our caseloads very small so that our clinicians can really spend that quality time with the clients, whether that means they meet with them 2-3 times a week for family therapy, individual therapy, consults. And we also have a pretty diverse background of clinicians and providers on our team, all in one place, which I think is pretty amazing. We have clinicians that are certified in trauma-focused evidence-based practices. We have a developmental pediatrician on staff who's a medical provider who does medication management and consults with our clinicians, as well as the most exciting part that we have is a licensed clinical psychologist who can do cognitive testing for autism spectrum disorder, and again is another diagnostic clinician that we have to our disposal for our families to get that support, which is pretty unique. There are not many of that in this Kansas City metro region, and if there are, there's huge wait lists. So having that comprehensive, holistic team in one place, I think is super awesome, and I think it makes us unique in this field. This has been one of our CEO, Lori Ross's visions, is to bring clinical services, therapeutic services in-house, because we know that our families have huge barriers in accessing mental health services. Wait lists are long, the quality providers that accept insurance are limited. I would say majority of the clients that we serve are that high level need at FAC in general, and they would be seeking out mental health services in the community for their kids. And you know, Lori herself and her own kids were on wait lists for therapy, or they just couldn't locate a therapist that truly understood trauma. And sometimes, as we know, talk therapy is not the most appropriate method with kids that have severe trauma. And so I think just being able to hire and create that from scratch and being able to build a program that meets the need and also can provide that support and consultation to our other programs is where that came from. With 3 clinicians and a psychologist, we were able to serve 84 kids last year, unduplicated youth, which I think is pretty amazing. Our treatment lasts between average about 6 to 12 months, sometimes longer if our kiddos really, continue to need that high level of intensive trauma. Of those 84 kids, 87% successfully completed their treatment and successfully graduated from therapy. And then we do some assessments to track their progress that are clinical assessments, and 94% of them made improvement on those assessments, meaning that their scores got better. And we're able to review that with the client and the family to show that progress. Like, look, this is what you've been able to do over the course of your treatment and over the course of all the other supports that you might have in your life. So I feel like the program's been pretty successful. We're still learning, we're still growing, we're still trying to figure out what's the next step and how can we continue to grow. FosterAdopt Connect celebrates the big 25 anniversary, so we're looking at how can we continue to move forward and continue to make progress. And one of the things that we would really love to be able to do now that we've been able to be certified in some of the evidence-based practices and we are officially rostered, is how can we become that consultant? How can we become that support to other clinicians and other organizations and even within our own other programs? So now, we built internal capacity for the past 3.5 years. Now how do we build external capacity? How do we leverage the amazingness that FosterAdopt Connect has to offer in our clinical program and teach that out? Presenting at more national conferences and making an impact in the community. And my selfish goal is that we're able to hire more clinicians, right? We're able to grow to some of our other areas around, the other communities that FosterAdopt Connect serves. Because we know our rural areas are very, very short on qualified mental health professionals, and some of their families in the communities that FosterAdopt Connect serve, they have to travel hundreds of miles to find the next clinician that's able to see their kids and their families. And so how can we overcome some of those barriers? How can we be creative and potentially providing some virtual therapy support or virtual consultation support to those families and those communities that FosterAdopt Connect is already in.